Now, ketamine's journey is really transformative in the medical field. It really gave us a remarkable shift from its traditional role. Now, a lot of people don't know, but ketamine belongs to the Fetty family. PCP, angel dust. It was a substance that was utilized as a illicit substance. It's an anesthetic. So, PCP is an anesthetic, but its use was marked with disastrous adverse effects because it caused people to suffer from hallucinations. Hello, and welcome to our new episode of Unmuted, the Diaries of the Virtual Psychiatrist. I'm your host, Dr. Rifai. Let's cut to the chase. I am talking about ketamine today, the Ketamine Chronicles. I've been a psychiatrist for more than 25 years, and I've been always dedicated to understanding how do we treat complex psychiatric issues. And early on in my career at the National Institute of Mental Health, I was involved with ketamine. And in my training, we were able to utilize ketamine on individuals who were struggling profoundly with treatment-resistant depression. And we now know that ketamine is a compound that helps individuals who are in treatment-resistant depression, anxiety, post-traumatic stress disorder. And today I will talk to you about my journey and how we explored this groundbreaking treatment and tell you how I witnessed firsthand its transformative impact on patients who were struggling significantly with psychiatric issues. My experience with ketamine dates back to the year 2003 when I joined the National Institute of Mental Health in Bethesda, Maryland, where we were doing cutting edge and groundbreaking clinical and experiments and applications on individuals that nobody else wanted to treat. And during that time, I've administered ketamine treatments to numerous patients that have exhausted all other treatment modalities, and only to see a remarkable and near miraculous improvement in their symptoms within hours or days. And really a stark contrast to traditional antidepressants that typically require weeks, even to months for it to work. So at NIH, we did some clinical trials. It was the Mood and Anxiety Program. And in 2006, they published a seminal paper documenting the utilization of intravenous ketamine. Even though in our trials at NIH, we utilized ketamine as an oral agent, we utilized it as an intramuscular agent, and we documented how we use it as an intravenous agent to help individuals who were struggling with treatment-resistant depression. This work was always complemented with continuous academic inquiry, providing a understanding of the nuanced action of ketamine. Now, ketamine's journey is really transformative in the medical field. It really gave us a remarkable shift from its traditional role. Now, a lot of people don't know, but ketamine belongs to the Fetty family. PCP, angel dust. It was a substance that was utilized as a illicit substance. It's an anesthetic. So, PCP is an anesthetic, but its use was marked with disastrous adverse effects because it caused people to suffer from hallucinations. And so it was a physician in the 60s, Calvin Stevens, who was a scientist at Park Davis Laboratories. And he basically was trying to figure out how can we produce a compound similar to phencyclidine. And I'm going to show you the chemical composition of ketamine. So he was trying to produce a compound that was similar to phencyclidine, PCP, but without the hallucination that produces this anesthetic function, reliable anesthetic, rapid, something that would be valuable. And in 1962, he was able to synthesize this compound. And they quickly moved to clinical trials. And they tried it in basically surgical fields, in trauma, and in battlefield situation. Provided a unique opportunity because it's a very effective anesthetic without any compromising of the patient's oral and respiratory drive. And it had a critical function in kind of difficult resources in the battlefield. Parke-Davis Laboratories moved forward with their clinical trials, and in 1970, it was approved by the Food and Drug Administration for use in humans. And it was initially known as C81, and it gained reputation as a revolutionary anesthetic because it was safe, it did not cause any suppression in the respiratory drive, it had a speed of onset, it acted quickly, relaxed people very, very quickly, and it had also a distinct dissociative experience. People feel that they're floating. They have this floaty feeling when they receive ketamine, whether it's intravenous, whether it's intramuscular, whether it's oral, and provided the patient that would appear that they're awake with a profound detachment. And this profound detachment detached them from any sensory input with pain and discomfort. So this is how it worked as an anesthetic. You kind of detach them from the sensory input and cause them to have this floaty feeling. Now, throughout the 70s and 80s, ketamine's medical application really brought, it became a staple in battlefield situations and was used by medics in the Vietnam War when it was approved. And it would help individuals who had suffered from injuries. It would help individuals who were struggling with fractures and really cause significant safety profile in calming pains in the battlefield without compromising the airway. It also gained significant attention in pediatric field. So pediatricians and surgeons would use it for anesthesia in little kids who required monitoring. My brother is an ophthalmologist and he's a retina specialist, and he utilizes the medication for anesthesia for neonates to do examinations on their retina because it does not cause any respiratory suppression and does not require any extensive respiratory support. Now, the ketamine story really took an unexpected turn in the 90s. Because it was used as an anesthetic, a lot of individuals, especially those who were in Vietnam, that it also had a mood uplifting effect. These were individuals who were in Vietnam and they had injuries, but they received ketamine to wound changes and to help with fracture. And they experienced that ketamine was causing a significant mood uplifting effect. And these anecdotal reports from anesthesiologists really pushed for psychiatrists to employ ketamine to see if they can help notice any improvement in patients. And it was two psychiatrists, Dr. Dennis Charney and Dr. John Crystal at Yale, who started utilizing ketamine in its IV form and it's an intramuscular form for the treatment of depression. And this sparked significant scientific curiosity until I was involved in those trials when I reached the National Institute of Mental Health in Bethesda, Maryland in 2003. Researchers there had begun exploring ketamine's potential beyond anesthesia as a treatment for refractory depression. And I was somebody who specialized in internal medicine and psychiatry, and I was the perfect assistant to help monitor patients who were receiving intravenous ketamine infusions for the treatment-resistant depression. At the National Institute of Mental Health on the inpatient units, under the supervision of Dr. Dennis Charney and Dr. Carlos Zarate. And we can show you an interview with Dr. Zarate from those days where he talked specifically about how ketamine was first identified. And this pioneering research team did the first known trials of ketamine, where we gave intravenous infusions at different doses, in addition to intramuscular injections and oral administration, and to observe the rapid acting of ketamine. And we published this landmark study from the National Institute of Mental Health in 2006. And in that paper, we really provided compelling evidence of a rapid and substantial antidepressant effect in mere hours in patients who were experiencing treatment-resistant depressive symptoms, as well as in individuals who were experiencing suicidal ideation. While the conventional antidepressant medications needed weeks, if not months, to provide their antidepressant function. Several people that I worked with at the National Institute of Mental Health then actually splintered and joined a pharmaceutical company, Janssen, to investigate how they can employ ketamine as a treatment for depression. Now, ketamine's pharmacological complexity is really profound. It's an enantiomer, meaning that it is a compound that has two sides. It has a right side and a left side, an S side and an R side. So the S side, we called it S, and an R side that we call it R ketamine. And each side, each enantiomer of this compound really exhibited pharmacological properties and clinical effects. S-ketamine was developed as a nasal spray, and Janssen Pharmaceutical, part of Johnson and Johnson, developed it and created a patent for S-ketamine. And subsequently, after extensive clinical trials in 2019, it was approved by the Food and Drug Administration as a treatment for refractory depression. It was notable for its potent affinity and rapid therapeutic action as a nasal spray, particularly in those with depression. They later on in 2022 were able to secure the approval for esketamine for treatment of individuals who were experiencing suicidal ideation. Now, how does ketamine work? And I know I don't want to bore you with all of these acronyms for receptors, but the story of ketamine is really very, very important because it's a departure from our typical agents that work on serotonin and norepinephrine and dopamine. You know, people know the SSRIs, the selective serotonin reuptake inhibitors, the norepinephrine reuptake inhibitors. So Prozac is the typical SSRI, Wellbutrin is the typical NRI. There are other agents, but ketamine works really in a totally different mechanism. It worked on glutamate, something new that we've never heard of before, and it has its action at NMDA receptor, which modulates the glutaminergic neurotransmission. And so it's a non-competitive antagonist of the NMDA receptor. It is also a weak agonist at the U opioid receptor and at the kappa opioid receptor. Really tells us how it is a good anesthetic. It also works on the AMPA receptors and can facilitate this release of glutamate, which causes this significant improvement in depression, and also can facilitate the production of the brain-derived neurotrophic factor, BDNF, which is essential for neuronal growth and resilience and mood regulation. So that's very, very important. Now let's listen to an interview that we conducted with a patient, and he tells us his experience with ketamine. Ketamine has always been in the news. And here we see a piece from CNN, Dr. Sanjay Gupta, where they talk about ketamine and its pioneering and groundbreaking role in basically treating individuals with depression and suicidal ideation. And here we also see doctors at the National Institute of Health presenting to President Trump during his first term how ketamine has been a groundbreaking discovery done at the National Institute of Health.
This is a great time in psychiatry.
Could a drug stop suicidal thoughts in hours? Literally, it's an incredible thing to even suggest. Well, there is a drug. It's called ketamine. It's an anesthetic, also used illicitly as a club drug, and it's now being used by some doctors who have patients in a serious suicidal state.
Ketamine is a medication that was approved in the 60s and 70s for anesthesia.
Dramatic advances in treating depression. Lithium was invented here. Ketamine now turning to be a really exciting development for people with resistant depression.
In general, it takes about 10 weeks or so after starting an antidepressant for about 1/3 of people to get substantially better. With some of our research, we've been looking at compounds that develop a rapid onset of antidepressant action. Actually, we can get the same effect within a couple of hours or even one day. And so that finding with a drug called ketamine, which taps into a neurotransmitter in the brain, which is glutamate. It's an excitatory amino acid important for modulating other neurotransmitters believed to be involved in depression. We can modify glutamate levels and its site of action or its effects very rapidly. And we believe that this would lead to better treatments that work in hours instead of weeks.
Can you tell me a little bit about your experience with treatment with ketamine since you started treatment, and how do you think it has helped you?
Well, doctor, as you might know, we started on the inhalation, which is Spravato.
Yes.
I don't think it did anything for me. However, the end muscular injection, right away, probably from the first injection.
Okay.
I felt different.
Can you tell people how did you feel? How did you feel different? How did it affect your mood? How did you affect your anxiety?
I would say from zombie, honestly zombie with catatonia, to actually looking for a job to improve myself. The past 3 months, I would say never felt so much closer to my original self before.
Did it help you? I understand also in the past you've had issues with having suicidal thoughts.
Oh, yeah.
And we've talked about that safety and not wanting to continue on living and wanting to die, and how has ketamine helped you with the suicidal thoughts?
Was the most helpful than any other medication.
How did it like completely get rid of the suicidal thoughts? What do you think happened?
I would say from planning with a solid plan of suicidal into 98% no suicidal thoughts. As I said, the last 3 months actually did make a difference. I never thought about even suicide.
And you had told me that you're so much better that you're looking for a job, you're
Yes.
interviewing, you're doing very, very, very well.
Okay. I was unemployed for at least 6 years.
Okay.
Yeah.
So when you come here for the treatment, tell our patients what does the treatment. So you come in here, you're in a room, you're on your own, and then you get monitored. We hook you up to blood pressure machine and a pulse ox, and then you get your medications. How is the experience for you? What do you feel?
Well, I feel very safe actually. I get the treatment. Maybe I won't be very conscious, but at least since I feel safe. Also, the first treatment only, the experience was so new. It did scare me, but then no, it didn't scare me whatsoever.
Okay, all right. So you recommend for people to get ketamine treatment if they have treatment refractory symptoms and treatment refractory depression like yours?
Definitely. I already, whenever I see my cousins, I tell them about ketamine.
And we have your permission to publish this so other patients would know the benefits of ketamine treatment, and they would benefit from your experience.
Absolutely.
Okay, all right. Thank you.
Thank you, doctor.
And usually it results in the patients going through remission from their depression and suicidal thoughts.
Blue Mountain Psychiatric Care, improving lives with personalized choices that work.
Set it for every 5 minutes. So maybe that's why. I don't know why he's still on my phone singing. Oh. So you were telling me about him, that he suffers from depression?
His mom is a drug addict.
Okay.
And he
If you, your loved one, or someone you know lives with depression, mental illness, anxiety, PTSD, stress disorder, OCD, or pain syndromes, then you understand the impact it can have on not just you, but all their loved ones too. Dr. Muhammad Ali Rifai and the understanding team at Blue Mountain Psychiatry are on the forefront of ketamine infusion therapy, a life-changing option that gives fast-acting results to their patients.
Blue Mountain Psychiatry is a unique practice because we treat our patients with the utmost interest in getting them to remission.
Dr. Rifai tells us how ketamine treatments work and how it helps to improve lives.
Ketamine is a medication that was approved in the 60s and 70s for anesthesia. It is a very safe anesthetic because it does not cause any suppression of the breathing. Patients who have refractory symptoms of depression, anxiety, bipolar disorder, post-traumatic stress disorder, who haven't responded to medications, who haven't responded to other interventions, who are experiencing chronic suicidal ideation, come to our practice, they receive a multidisciplinary assessment, and they're assessed for all of their symptoms and for all treatment approaches that have failed. We subsequently do an extensive informed consent process and a medical workup and offer them ketamine infusion, which is a treatment that involves infusion through an intravenous catheter of ketamine for 45 minutes. The patient is safe in our office. He is monitored through our registered nurse, and I am in the office monitoring the infusion. We usually administer 3 infusions a week, and the course consists of about 6 to 12 treatments. And usually it results in the patients going through remission from their depression and suicidal thoughts.
Blue Mountain Psychiatric Care, improving lives with personalized choices that work.
Now, clinically, ketamine is administered through separate and different routes. Intranasal, as a nasal spray. It comes in oral lozenges. And the effectiveness varies in terms of different of administration. Well, I provide in my office intramuscular ketamine, which is the generic ketamine. Intranasal ketamine, also branded as Spravato, provides convenience and ease of administration in outpatient setting. Now, patients' experience, as we heard from our patient, has been really transformative. A lot of them report significant improvement in terms of their mood, typically faster than other agents. Now, for example, patients who struggled for years not being able to find a medication that would help them have always been able to get some relief with ketamine. Now, ketamine's significant benefit also comes with one noticeable risk: its potential for misuse and recreational use. A lot of people have heard about actor Matthew Perry and how he lost his life and how ketamine use for depression has been blamed for his loss of life. Now, to mitigate these risks, the Food and Drug Administration has implemented a rigorous safety measure utilizing a risk evaluation and mitigation strategy, REMS, that balances the therapeutic efficacy with strict oversight to ensure the responsible ketamine use and to safeguard against abuse, dependency, misuse that could harm patients and could mitigate the beneficial effects of ketamine. Now, looking to the future, ketamine really holds enormous potential as a medication for psychiatric care. In future episodes, I'm going to talk to you also about psychedelic medications and how ketamine is opening this avenue for us to deploy psychedelic medications in the treatment of psychiatric illness. In fact, it is thought to be the first psychedelic medication that we've utilized to help patients, and how these psychedelic medications impact different neurotransmitters that we haven't tapped into or we've used before, and how that in psychiatry, there's a need for a personalized treatment approach, involve tailored dosing and administration of unique medication that potentially can help and can treat their refractory symptoms. We're also going to talk in the future about how ketamine can be utilized adjunctly with other treatment modalities. For example, in my office, I've talked to you in a previous episode about transcranial magnetic stimulation. And for patients who are experiencing treatment refractory depression, sometimes we prime the brain with transcranial magnetic stimulation, and then we utilize ketamine as a neurotrophic growth factor that restores a lot of those lost neuronal connections in the brain. Ultimately, the development and refinement of ketamines and ketamine-like compounds, such as we've talked about esketamine, which is the right side, or ketamine is being developed as a pill treatment for depression that will also impact glutamate. That will help us also develop other rapid-acting antidepressants, such as the psychedelics. We talked about MDMA, and these are all new compounds that are going to usher a new era of psychedelic use in the treatment of psychiatric illness. We know that psychedelics have a bright future, and I'm going to talk to you in future episodes about how psychedelic could be helpful for us. But I truly think that ketamine has been at the forefront of these compounds, and I think that ketamine is going to continue to be helpful to our patients, and it's going to be the stepping stone for us utilizing psychedelics in the future to help individuals who are struggling with psychiatric illness. I think that ketamine has caused a significant shift in our understanding of psychiatric illness, in our understanding of how different neurotransmitters are the source or are responsible for episodes of mood instability and depression. And it really promises hope and relief to countless patients worldwide who are struggling with severe psychiatric illness. Until next time, where we talk about other word treatment modalities, I hope that we are going to be taking you on a journey of discovery and how my career has been at the forefront of groundbreaking treatment. I'm Dr. Muhammad Ali Rifai, and to our next episode.